Hey everyone, I'm going to show you how to do a TPR on a dog. TPR is short for temperature, pulse and respiratory. However, we are going to be checking all of Java's vitals. So that's our heart rate, respiratory rate, temperature, pulse, mucous membranes and capillary refill time. We do shorten it to TPR because it's easier to say let's go and check the TPR on that dog rather than let's go check the TPR HR, MM, CRT and all of that stuff. It just gets a little bit too confusing. Now yes, of course, for safety reasons, PPE is priority, so make sure you glove up, especially when you are doing the temperature, because you don't want to end up with any bits of poop fragments on your fingers. Doesn't matter what order we do things in, yes it does. Okay, so temperature is definitely going to be the last thing that we're going to do. Why is that? Because if we do the temperature first, what's going to happen with Java is her heart rate's going to go through the roof. And I'm sure that would happen to you too if someone came and stuck something up your bum. So that's going to be our last thing that we do, okay? The first thing that you can do is respiratory rate. And that can be done through distant examination, which means you don't even need to touch the dog to do that. You can just look for the rise and the fall of the chest and count her respiratory rate that way. So one rise and fall, that's one breath. So we want to be counting for 15 seconds, times that by 4, and then that is your 1 minute respiratory rate count. Mucous membrane colour is the actual colour of the gums. Okay, so you want it to be a nice pink colour. Okay, show the gums above the canine, press there to blanch the colour, release, count how many seconds it takes for the colour to return. A healthy one should be less than 2 seconds, so 1 to 2 seconds for the colour to return. Okay, the thing I see students when they are doing this is they kind of take forever, and dogs don't really like you having your fingers in their mouth for ages. Look, Java's getting fed up, okay? This is annoying. It's annoying. Imagine you having people fingering all through your mouth. It's going to get frustrating. So you want to kind of be in and out and do this relatively quickly, yeah? Just enough to count, so don't stuff around forever. Just know where the canine tooth is, lift up the lip, press, 2 seconds, done. That's your capillary refill time. That's going to give you an indication of their circulation status. Next, we're going to do the heart rate. Where's the best place to listen to the heart? Is it at the front of the chest? No. She's not a human being. Is it on the right-hand side? No. Is it on the left-hand side? Yes. Locate the heart. What's the best way to do this? In most dogs, you can actually just pick up their leg, and where their elbow is hitting should be pretty accurate to where the heart's going to be. So hold your stethoscope around there, or just move it until you hear a solid drumming sound, and that's going to be your heart rate. It might be hard to hear heart if they are panting or breathing loudly. You can hold their mouth shut for a few seconds, just long enough for you to count the heart. Count that over 15 seconds, times it by 4 to get your 1 minute heart rate. Now Java actually has a sinus arrhythmia, which is where the heart changes rate every time she takes a breath. This isn't a concern. It's not really abnormal. It's pretty common in dogs. If you hear things like a douche, 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 or a real whoosh, 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 whooshy sort of sound, it could be an indication of a heart murmur, and you want to be mentioning that to your vet. Okay. Also, when you are checking the heart rate, you should be trying to check the pulse at the same time. It can be tricky on a dog that's very fidgety, so you may need assistance in doing that. But essentially what you want to do is 2 fingers, not your thumb. Never use your thumb to check a pulse. Use 2 fingers on the inside of the femoral artery, just on the inside of the thigh. And you should feel like a nice big vein, and you should feel the pulse on your fingers. Now you want to be listening to the heart rate at the same time and make sure it is actually matching, which is really hard for me to do right now because Java's panting, so this is where I would actually have someone helping me out. And then lastly, temperature. Don't worry, I'm not going to do it in real life. Thermometer, make sure it works before you poke it up their butt, okay? Very important. Beep. Yep, it works. Okay, cool. Lubricant. Cover. Hey, get a cover and a lubricant. All right, lubricate it. Lift up their tail. Don't shove it in there. Just gently insert it. You may need to wiggle it a little bit, okay? A little wiggle. And you're not poking it all the way up, trying to actually retrieve some poo sample. That's not what we do. You're just poking it in slightly, not forcefully, just slightly, and edge it close to the wall of the rectum, okay? Because that's where you're going to get the most accurate temperature. Hold it until the thermometer beeps. That has retrieved your temperature, and then you can pull it out, okay? Do not poke it in there and let go. Yes, they have muscles in the rectum and they can move it in and out, okay? They can poop it out. Sometimes they can suck it a little bit in. So don't leave it in, hold on to it, glove up. And that is essentially how you do a TPR on a dog.